Do you have difficulty with attention and concentration? Both anxiety and ADHD can cause these. So let's talk about 5 symptoms that indicate you have ADHD, not anxiety. Hi, my name is Dr. Air. I'm a board certified lifestyle psychiatrist. According to the National Institute of Mental Health, about 11 million adults struggle with ADHD in the US. This condition can cause difficulty at work, school, relationships, and other aspects of life. Living with ADHD is like having a mind that is moving as fast as the internet, except it's got 100 tabs open at once. Just when you think you're focused on one page, another tab starts playing a video you didn't even remember opening. It's like a mental ping pong match where the ball never stays in one place long enough for you to catch your breath. So let's talk about 5 symptoms that indicate you have ADHD and how this differs from anxiety. Number 1, inattention. Trying to focus with ADHD can feel like being a squirrel who just had a triple espresso. Every little thing grabs your attention. Your mind races from one distraction to the next, and you find it impossible to focus on one task. New distractions pop up faster than you can handle. You fail to give close attention to details or make careless mistakes. Sustaining attention in tasks is challenging because your mind continues to wander. Friends and family members may say you don't listen to them, and you also struggle to follow through on instructions. While both ADHD and anxiety can result in inattention, the root causes, context, and features are different. With anxiety, the inattention usually stems from excessive worry or fear. You may be preoccupied with anxious thoughts, making concentrating on other tasks hard. The inattention with anxiety is often situational and triggered by specific stressors or concerns. When the anxiety is treated or the stressor is removed, concentration improves. Number 2, difficulty organizing tasks and activities. A patient once described having ADHD as trying to assemble a jigsaw puzzle with missing pieces and no picture on the box for guidance. You may have difficulty managing sequential tasks, struggle with keeping your materials and belongings in order, have messy and disorganized work, have poor time management, and fail to meet deadlines. You may also easily lose school materials, tools, wallets, keys, eyeglasses, paperwork, and even your phone. Because you may be very forgetful, chores, errands, returning calls, paying bills, and keeping appointments become problematic. So, can anxiety also cause difficulty in organizing tasks and activities? The answer is yes. And this is because anxiety can create a mental state where everything feels overwhelming. When you're anxious, it is harder to focus and prioritize tasks. Anxiety can cause overthinking, where you worry about every possible outcome or detail. This can make simple tasks seem much more complicated, leading to indecision and procrastination. Anxiety can also cause physical symptoms like restlessness, fatigue, or difficulty sleeping. These symptoms can drain your energy and make it harder to motivate yourself to organize and complete tasks. Number 3, hyperactivity. With ADHD, it can feel like you have a motor inside you that never stops running, constantly driving you to move, fidget, and act. You may find yourself fidgeting a lot, squirming in your seat, or tapping your hands and feet. Sitting in meetings, watching a movie, or listening to a lecture may be difficult. This tends to be more common in children than adults. Hyperactivity, as seen in ADHD, is not a core symptom of anxiety disorders. Certain behaviors associated with anxiety can, however, resemble hyperactivity. People with anxiety can often experience restlessness, which can involve fidgeting, pacing, or an inability to sit still. While this may resemble hyperactivity, it is usually driven by an internal sense of nervous energy or unease rather than the more generalized hyperactivity seen in ADHD. In high anxiety or panic, some people may exhibit psychomotor agitation, which manifests as repetitive movements like tapping feet or drumming fingers. These movements can look like hyperactivity. In ADHD, hyperactivity is often purposeless and occurs across various situations without specific triggers. In anxiety disorders, movement or restlessness is often related to the anxious feelings and usually goes away when the anxiety is treated. So, while hyperactivity is not a symptom of anxiety disorders, irritability and restlessness related to this condition can mimic hyperactivity. These behaviors are typically situational and driven by anxiety. This presentation is different from the hyperactivity seen in ADHD. Number four, impulsivity. You may find yourself blotting out an answer before a question has been completed. Some people finish other people's sentences as they are unable to wait for their turn in a conversation. Some people with ADHD talk excessively and interrupt conversations, games, or activities. Impulsivity in ADHD is like having a mouth that speaks before the brain has had a chance to catch up, words often spilling out unfiltered. Impulsivity is not a core symptom of anxiety disorders. It can, however, occur in certain contexts. An example is decision making under stress. People with anxiety might make impulsive decisions when they are overwhelmed by their anxious thoughts or feelings. This can happen when they feel a need to quickly escape or avoid a situation that triggers the anxiety. So, impulsivity in anxiety is more situational, often driven by the need to quickly relieve the distress that comes from anxiety. Number five, family history. This is not a symptom of ADHD, but it plays a significant role in the development of this disorder. ADHD is one of the most heritable psychiatric disorders. Studies show that ADHD tends to run in families, with genetics accounting for about 70 to 80% of the risk. Children with a parent or sibling with ADHD are more likely to develop the disorder themselves. Specific genes related to dopamine regulation, which influences attention and behavior, have been implicated in ADHD. If you think of your focus as a lantern that guides you through a dark forest, with ADHD, the lantern's light flickers unpredictably. Sometimes it shines bright on one task, and other times it dims or jumps to another part of the forest without warning. This inconsistency makes it hard to see things clearly or stay on a chosen path. You navigate the shadows and sudden bursts of light, searching for the stability others might take for granted. With anxiety, there is also a genetic component, which means it can be passed down in families. There are, however, other differences between ADHD and anxiety in this regard. With ADHD, inattention is linked to factors like differences in brain structure and function. This occurs in specific regions of the brain that help with planning, organizing, and regulating attention. It is not usually tied to specific worries or fears, but is more about a constant inability to focus. This is not the case with anxiety disorders, where inattention is linked to psychological factors like worrying about negative outcomes, past experiences, or future events. When you are anxious, your focus shifts away from the task at hand because your brain is preoccupied with perceived threats or stressors. Let's talk about the treatment for ADHD and anxiety disorders. Before doing this, let's quickly distinguish between the criteria for both. The fifth edition of the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, has set criteria for ADHD. You must meet at least 6 of the 9 symptoms for inattention or hyperactivity, impulsivity. The symptoms must also have persisted for at least 6 months and impact your social life, work, or school. Several of these symptoms must be present before age 12 and in 2 or more settings, such as at home, school, or work. With anxiety, the DSM-5 also has set criteria. You must have at least 3 of these 6 symptoms: restlessness, easily fatigued, difficulty concentrating, irritability, muscle tension, and sleep disturbance. You must also have excessive anxiety and worry occurring on most days for at least 6 months. This anxiety is difficult to control and affects your social, work, and other important areas of your life. Now, on to treatment for anxiety and ADHD. Treatment of anxiety typically involves therapy focused on managing anxiety and worry. Cognitive behavioral therapy is a common form of therapy your therapist may use to help you with anxiety. In severe cases of anxiety, medications like selective serotonin reuptake inhibitors, SSRIs, may be used. Examples are Prozac, Zoloft, and Lexapro. Other medications that may be used for anxiety include Effexor, Cymbalta, and Buspar. Benzodiazepines are occasionally used with caution for short periods due to their addictive potential. For ADHD, treatment often involves medications. Stimulants like Ritalin, Concerta, Adderall, and Vyvanse are first line. Non-stimulants like Strattera, Wellbutrin, Xanax, and Clonidine can also be used as second-line treatment for ADHD. Cognitive behavioral therapy may also be used to address the emotional and behavioral aspects of ADHD. Behavioral interventions focusing on improving organizational skills and attention are helpful. To learn more about the treatment of ADHD and anxiety, check out these videos. I'll speak with you soon.